Sugar-sweetened beverages dominate the American diet, contributing to nearly half of the added sugars we consume. Today, we'll help counter that. We'll examine a list of drinks that can naturally regulate blood sugar levels. Grab your favorite mug and sip your way to better health. Hello again and welcome to my YouTube channel, Dr. Hanz MD, where we 10x your success by optimizing your health. We've all heard how sugary drinks contribute to weight gain, even obesity. Let's examine fantastic alternatives that not only slash your sugar intake but also actively help manage blood sugar levels. Watch this video with me.
Let's talk about a fundamental. Number 11, water. Water is vital for controlling blood sugar. Water should be your primary beverage of choice. When you are even slightly dehydrated, your body does not function efficiently, and this leads to high blood sugar. Water dilutes the glucose in your blood and allows the kidneys to flush out any excess glucose. So the single most important way to dilute your blood and reduce blood glucose is to drink plenty of water. For women, the daily recommendation is around 1.6 liters or 6 cups, and for men around 2 liters or 8 cups, although this will vary depending on your lifestyle and your unique constitution.
When life gets busy, our water intake often takes a back seat as we get preoccupied. While we sip coffee, tea, or other beverages, we might forget the simplest drink of all, and that is water. Dehydration can sneak up on us, especially during hot weather, intense workouts, or illness. When we lose more water than what we take in, the concentration of sugar rises. As water leaves our bloodstream, the concentration of glucose increases. Even mild dehydration can cause blood sugar levels to spike. To avoid this, we should set reminders just like we set alarms for meetings. Amid the sea of beverages, prioritize plain water and listen to your thirst. When your body whispers, "I am thirsty," don't ignore it.
Number 10 is lemon water. There are many benefits of drinking lemon water. A recent trial published in the European Journal of Nutrition found that drinking lemon water was associated with 30% lower blood glucose levels after eating, compared to people who drank plain water. According to researchers, lemon reduces the glycemic response by increasing the meal's pH level and slowing digestion, meaning that glucose enters the bloodstream more gradually and prevents dangerous blood sugar spikes or hyperglycemia. Other studies have found that lemon increases insulin sensitivity and improves the breakdown of lipids, which is good news for healthy blood sugar, as well as supporting weight loss and healthy weight management and preventing cardiovascular disease. Lemon has also been shown to reduce the incidence of diabetic neuropathy, nerve damage brought on by persistently high blood sugar. Finally, lemon water is a good source of vitamin C, which has been shown to aid the regulation of blood glucose levels and, of course, boost immunity.
I can see why lemon water helps. Juice from lemons can actually slow the starch to sugar conversion of carbs, lowering the overall glycemic index. Lemons are rich in vitamin C that can be protective against the development of type 2 diabetes. But moderation is key. Acidic drinks can erode tooth enamel and can even trigger heartburn.
At number 9, ginger tea. Ginger tea is made by steeping grated ginger root in hot water and combining with a squeeze of lemon if you wish. Its health benefits are mainly attributed to its potent antioxidant and anti-inflammatory properties. Research shows that ginger can help to control blood sugar levels in people with diabetes. One randomized, double-blind, placebo-controlled clinical trial found that ginger significantly reduced the levels of fasting blood sugar, hemoglobin A1C, and apolipoprotein B, markers associated with diabetes-related complications and long-term blood sugar control. Other studies have shown that ginger reduced markers of heart disease, and a number of animal and human trials have identified benefits for weight loss. Moderation is key with ginger, as excess can cause heartburn and stomach problems. That's why experts recommend no more than 4 grams per day. If you take medication and don't currently eat ginger, talk with your doctor before adding ginger tea to your diet, because it can interfere with some medications.
Emerging research suggests that ginger can lower fasting blood sugar levels and hemoglobin A1C, the measurement of blood glucose over a 3-month period in individuals with type 2 diabetes. Side effects are rare, but it's best to be mindful of your intake. Pregnant women should be limited to 1 gram per day. It can also interfere with blood thinners and blood pressure medications, so consult your doctor before including it in your daily routine if you take those medications.
Number 8, apple cider vinegar. Apple cider vinegar is booming in popularity due to its ability to detoxify and alkalize the body. While there isn't a ton of research yet, a number of small studies have shown apple cider vinegar to be effective in controlling blood sugar levels. One animal study found that rats who were given apple cider vinegar reduced their A1C long-term blood glucose levels. Another human study found that drinking 20 milliliters of apple cider vinegar in water significantly reduced blood sugar levels after eating. The thing to note here is that you only need a small amount mixed with water, lemon water, or in your ginger tea. And it's best to start very small and gradually increase the amount over time, as consuming too much too quickly may cause digestive upset.
I've mentioned in another reaction video, dilute the ACV in water a few minutes before your meal. Sip it slowly to avoid overwhelming your taste buds. Remember, never drink vinegar straight, as it can irritate the esophagus and damage your tooth enamel. For many people, adding 2 tablespoons of ACV to a glass of water taken a few minutes before a meal has blunted sugar spikes.
Number 7, pomegranate juice. If you're a diabetic and looking for a more blood sugar friendly alternative to orange juice, then pomegranate juice is a good option. Pomegranate juice is full of phenolic compounds, which have been shown to aid blood sugar balance, as well as improving artery health and reducing the risk of heart disease. A clinical study published in the Journal of Nutrition Research found that drinking pomegranate juice improved insulin resistance and reduced fasting blood glucose in type 2 diabetics. In the trial, 85 type 2 diabetics were given pomegranate juice and had their serum glucose measured after 1 hour and again after 3 hours. The tests showed decreased fasting serum glucose, increased beta cell function, and decreased insulin resistance. Why pomegranate? This brilliant red fruit is known to contain a unique antioxidant profile in the form of tannins and anthocyanins, which are believed to offer a number of blood sugar regulating benefits. However, remember that even organic pomegranate juice contains reasonably high levels of sugar, so always practice moderation when it comes to juice. Additionally, eat something rich in protein or healthy fat alongside your pomegranate juice to avoid blood sugar spikes. And let's be honest, it's even better to eat the whole fruit whenever possible to get the full fiber benefits.
As healthy as pomegranate may be, juice does not include the fiber that's integrated when eating the whole fruit. To minimize a glucose spike, enjoy it in a small cup and have it after meals. Protein and fat can help attenuate increases in blood sugar levels.
Number 6, coffee. If you need your morning cup of joe to start the day off right, we've got great news for you. Moderate coffee consumption may benefit blood sugar. In addition, coffee has been shown to reduce the risk of cancer, heart disease, stroke, and Alzheimer's disease. Coffee has trace levels of important nutrients such as magnesium, and studies have found that it has an anti-inflammatory effect. However, some diabetics are sensitive to caffeine. For some people, it will positively impact blood sugar balance, but for others, it may cause short-term spikes. So monitor how your body responds to coffee. Go for decaf if you find you have a problem with caffeine. And of course, we're talking about black coffee here. If you take sugar with your coffee, that's definitely something to cut, as it's going to spike blood sugar. And the same goes for artificial creamers that are packed with chemical nasties. If you enjoy these additives, try going a month without and see how your tastes can adjust. That way you still get your coffee hit without the dangerous side effects. And if you really insist, a little stevia and almond milk can help if you prefer your coffee sweeter or creamier, but black is ultimately best.
Some studies suggest that caffeine can behave differently for those with type 2 diabetes. For them, caffeine can lower insulin sensitivity. But if you keep your caffeine intake to less than 200 milligrams or about 2 cups of brewed coffee, the negative impact of caffeine on blood sugar is dampened.
At number 5, coconut water. Coconut water is nature's gift to healthy blood. Coconut water is so well suited to our bodies that it is sometimes injected directly into the bloodstream when intravenous saline isn't available. This emergency technique was used during World War II and is used in emergency situations on tropical islands when it's not possible to reach a hospital. Coconut water contains natural electrolytes, potassium, and manganese, which are important for blood health, muscle function, and nerve signaling. And although it tastes sweet, it's low in sugar, so it won't spike blood sugar levels. Laboratory research on rats found that coconut water is beneficial for stabilizing blood sugar, as well as preventing retinal damage associated with diabetes. Other studies showed remarkable improvements in HbA1c levels, better blood sugar regulation, and protection against oxidative stress. Just avoid coconut water that's had sugar added.
A 100 milliliter serving of coconut water provides 6 milligrams of magnesium. It's important in regulating blood sugar, blood pressure, and muscle function. It contains about 2 teaspoons of sugar per 200 ml of serving. Enjoy it occasionally and in moderation after a meal that includes some protein or fat.
Number 4, beetroot juice. Didn't expect to see this one on the list, huh? Beetroot juice is densely packed with vitamins, minerals, and unique plant compounds that improve blood sugar balance. Beetroot is particularly high in polyphenols and dietary nitrates, which have been shown to have a beneficial impact on glucose and insulin regulation. One study published in the Journal of Nutritional Science found that drinking half a cup of beetroot juice led to significant reduction of blood glucose levels after eating. What's more, beetroot may prevent the body from overloading on carbohydrate. Researchers believe that the polyphenols in beetroot actually inhibit carbohydrate absorption into the intestine, as well as modulating glucose uptake in the cells, helping the blood to maintain a healthy and stable level of blood sugar. Beetroot juice also contains very special compounds named betalains. Betalains provide the rich color pigment in dark purple beetroot and yellow beetroot, and offer potent antioxidant and anti-inflammatory protection, which help your organs and blood to function optimally.
A 2014 study on non-diabetics found that sipping about half a cup of beetroot juice significantly suppressed post-meal glucose level. Beets are rich in phytochemicals that play a role in glucose and insulin regulation. The antioxidants in beets reduce oxidative stress and free radicals. Fewer free radicals mean a lower risk of diabetes complications such as retinopathy, kidney disease, and diabetic foot issues. Keep to a half a cup serving around mealtime.
Number 3, red wine. Red wine is widely known to have benefits for the heart and blood health. The polyphenols in red wine have been shown to improve fasting blood sugar levels. White wine also contains beneficial polyphenols, but they are much higher in red wine, which is why it's often touted as the healthier option.
According to the American Diabetes Association, red wine can lower sugar for up to 24 hours. Red wine contains polyphenols. These compounds may stabilize blood sugar levels by altering glucose digestion and absorption. A red wine polyphenol positively impacts insulin sensitivity. Pair with a balanced meal to stabilize blood sugar. Savor, but never overindulge.
Number 2, tea. Tea is one of the most popular beverages in the world, and it has been associated with a variety of health benefits due to the various plant compounds that it contains. Some teas have properties that are especially beneficial for people with diabetes, such as black tea, green tea, and oolong tea. These teas help to control blood sugar levels and improve insulin sensitivity. Additionally, herbal teas such as peppermint tea, chamomile tea, and hibiscus can be helpful for managing diabetes symptoms. When it comes to lowering blood sugar, one tea stands out above the rest: green tea. Green tea is a winner because it's so good at fighting cell damage, which flows through to anti-inflammatory and blood sugar balancing benefits. A meta-analysis of 17 randomized controlled trials was published in the American Journal of Clinical Nutrition. Researchers found that green tea consumption significantly reduced the fasting glucose and hemoglobin A1C, and also reduced fasting insulin concentrations. Likewise, black tea is full of potent compounds called theaflavins and thearubicins. Studies have shown that these special compounds have a powerful impact on reducing blood sugar and helping to protect the insulin-producing cells in the pancreas. Keep in mind, though, that some teas, such as green tea and black tea, do contain caffeine. Some diabetics find that caffeine will impact blood sugar while others won't experience any impact. So be sure to monitor yourself and understand how tea affects your unique body. If it's an issue for you, you might like to try decaf tea. Finally, physical and chemical stress has a direct impact on diabetes, so a warm cup of calming chamomile tea is a perfect way to wind down at the end of the day while cleansing your blood. Chamomile contains an antioxidant called apigenin, which binds to certain receptors in the brain that have calming effects. Beyond its calming effects, studies have shown that drinking chamomile tea led to significant reductions in HbA1c levels and protects against oxidative stress. So as you can see, there are a number of teas with varying benefits for lowering blood sugar and promoting overall health.
Some other teas that are good for blood sugar control are guava leaf tea, bitter melon tea, cinnamon, and white matcha. These all improve insulin sensitivity and lower blood sugar. Choose loose leaf tea when available. These are frequently regarded as superior to tea bags due to their potential for enhanced flavor, health benefits, and nutrient content.
At number 1, we have kombucha. That's right, it's the latest fad and a potential replacement for high sugar soda, and for a good reason. Kombucha is made from tea that's been fermented, often with other flavors added in like lime and ginger or beetroot and pomegranate. During fermentation, bubbly acid and healthy bacteria form. A mushroom-like blob known as SCOBY also grows, creating probiotics which aid gut health. The final product contains various plant compounds, acetic acids, lactic acids, and EGCG. EGCG, or epigallocatechin 3-gallate, is one of the strongest antioxidants in kombucha and has been shown to reduce inflammation linked to diabetes. A review of 7 trials involving 1,133 participants concluded that EGCG significantly reduced fasting blood glucose and fasting insulin concentration. Thanks to its unique composition and antioxidant profile, kombucha is believed to be beneficial for blood glucose levels, blood lipids, insulin resistance, and chronic inflammation. As a diabetic, chronic inflammation means that the organs are overworking to process nutrients and eliminate waste. When the body is chronically inflamed, it becomes more resistant to insulin. Kombucha helps the body fight back against this. Several experiments on animals have found that kombucha may enhance the body's ability to slow down the digestion of carbohydrates, improve the quality and health of cholesterol, detox, and reduce the risk for diabetes complications. Kombucha is relatively new in terms of scientific trials, however, the early evidence is promising. The fact that kombucha is derived from tea also allows scientists to draw on similar studies showing the health benefits of tea for blood sugar control, as many of the same compounds are present in kombucha. But the main difference between tea and kombucha is the number of probiotics in kombucha. Probiotics are essential for healthy gut bacteria, liver health, and overall digestive function, which impacts how nutrients are absorbed into the body, including the regulation of how much glucose enters the bloodstream. But let's be clear, not all kombucha is made equal. Make sure to read the label and avoid added sugar, as that is going to spike your blood sugar no matter how much healthy probiotic you're getting.
Some kombucha brands can be high in sugar, which can negate any blood sugar benefits. Pay attention to the sugar content when purchasing kombucha. Kombucha contains live bacteria and yeast, which can be beneficial for gut health. However, people with weakened immune system or have certain medical conditions should consult their doctor before consuming kombucha. The fermentation process can produce a small amount of alcohol. Be mindful of this if you are pregnant, breastfeeding, or avoiding alcohol for any reason. We've reached the end of this video. This is a fantastic list of beverages to help us manage our blood sugar levels. But before we go, I'd like to share a few things. To maximize the benefits of these choice drinks, enjoy them with minimal or no added sugar, as you can go overboard even with natural sweeteners like honey or agave nectar. For prepackaged drinks like kombucha, be sure to check the label and choose the brands with the least amount of sugar. Also, consider any potential allergies before taking any new drink. If you have allergies to plants in the daisy family like chrysanthemums or marigolds, there's a chance that you might be allergic to chamomile tea. People with sensitivities to Malvaceae family should avoid hibiscus tea. If you have any concerns about your allergies, consult your doctor before consuming this or any new beverages. What's your go-to drink after a long day at work? Write your favorites in the comments below. And don't forget to share this reaction video with friends and family. And we hope to see you in the next episode of Dr. Hanz MD, where we 10x your success by optimizing your health.